A Bachelor's of Science in Nursing is a 4-year degree offered at colleges and universities. The first 2 years focus on classes such as biology, microbiology, nutrition, anatomy and physiology, and human growth and development. The last 2 years focus on classes such as adult, acute and chronic disease, pediatrics, maternal and child health, psychiatric/mental health nursing, community health nursing, nursing theory, and physical and behavioral sciences. A 4-year degree also provides experience and familiarity in the fields of nursing research, health informatics, healthcare policy, and economics, as well as contributes to the development of leadership skills in the workplace. There are currently only 31% of RNs who have received their education from baccalaureate programs. Achieving a BS or BSN is a great accomplishment that prepares graduates to engage in the full scope of professional nursing practice across all healthcare settings. Should a Bachelor's in Science of Nursing be the minimum degree required to qualify for the NCLEX exam, or is an associate's degree in nursing sufficient as well? Over the past 4 decades, there has been debate surrounding the issue of whether or not an associate's degree in nursing or a Bachelor's of Science in Nursing better prepares a potential nurse to practice as an RN, especially since there is a vast discrepancy in education between the 2 degrees, which have shown positive and negative effects on the care provided for patients. So what do you think? Do you think that attending a baccalaureate program should be considered the minimal and only educational pathway accepted in order to be eligible to take the NCLEX RN examination? It's debated because of the amount of variance between the 3 educations provided by each degree or diploma program. Some believe that nursing as a profession has been unable to progress and has suffered due to the multifarious levels of entry into nursing practice. Others believe that nursing does not meet the standards of professionalism due to the fact that there is no differentiation among educational levels in regards to acknowledgement and salary. Many believe that the role of the nurse is changing with the transformation of healthcare, but feel as though the level of education is staying the same, and this is evidenced by the small percentage of nurses who pursue higher education levels. I believe that nurses should be required to obtain a Bachelor's of Science in Nursing in order to qualify for the NCLEX RN examination, to help decrease discrepancies in knowledge between nursing education, which will contribute to increased quality and safety of care provided by nurses, resulting in better patient outcomes. Why should a BS/BSN be considered the minimum degree to qualify for the NCLEX? Well, higher nursing education levels have been linked to positive patient outcomes. Higher education levels such as a BS and BSN have been shown to contribute to improved patient safety and lower rates of patient morbidity and mortality, as well as lower levels of medication errors and procedural or practice-related violations and fewer disciplinary actions for BSNs. According to Kohlenberg and Lane, a nurse's critical thinking skills, confidence, maturity, and open-mindedness increase significantly with each year of schooling. Education is an extremely important aspect of the healthcare system. It's imperative for all healthcare professions to keep up to date with the many new advancements made in healthcare and technology each year. With nurses being a rather large part of the healthcare workforce, they cannot fall behind in regards to their education. Requiring higher education levels will improve the nursing practice in many different ways, but most importantly, it will contribute to increasing the safety and quality of care provided. Tri-Council organizations support for improvement of nursing education. The Tri-Council organizations include the American Association of Colleges of Nursing, American Nurses Association, American Organization of Nurse Executives, National League for Nursing. They all express support and encouragement towards nurses to receive higher education levels such as the BS and BSN. Nursing organizations encourage baccalaureate education for many reasons, but one of the most important reasons is to improve patient outcomes as well as the quality and safety of the care provided by nurses. Serving as leaders for the profession's educational infrastructure, the American Association of Colleges of Nursing is the national voice for baccalaureate and graduate nursing education programs, representing over 700 schools of nursing. and the National Organization for Associate Degree in Nursing is recognized nationally as the voice for associate degree nursing, representing community college nursing programs and individual members. These two organizations have come together to express their support for higher education levels in the nursing practice. In 2010, the Robert Wood Johnson Foundation and the Institute of Medicine released a landmark report called The Future of Nursing, Leading Change and Advancing Health. This report was commissioned to investigate what role nurses will play in addressing the increasing demand for safe, high-quality, and effective health care. After thoroughly investigating current trends and evidence-based research, the report outlined 4 key messages, which you can see below. These are recommendations made to help improve the nursing practice and healthcare system as a whole, and 2 of the 4 recommendations involve the improvement in nursing education. The improvement in nursing education can lead to the improvement of the nursing practice as well as the healthcare system. Medical knowledge is doubling every 5 to 8 years and is expected to start doubling every year, sometime in the future. This only makes it more imperative to start preparing nurses initially by requiring a BS and BSN to practice as an RN. Education has a huge impact on all healthcare professions. Advancements in technology and medical knowledge are made every day, and if healthcare professionals do not continually educate themselves, then patients won't be receiving the best care possible. That is why many in the nursing practice are advocating for higher education levels, so that the care provided is of highest quality and safety. More positive patient outcomes, higher quality of care, and increased patient safety. This is what the improvement of nursing education will lead to. The 21st century has presented many new challenges for the nursing practice to undertake, such as the rapidly growing population creating a greater demand and need for healthcare services, as well as the need to stay up to date on the many new advancements made in technology and medical knowledge each year. These challenges are even further complicated by the existing shortage of nurses, an aging nurse workforce, a shortage of nursing faculty members, and prospects of a worsening nurse shortage in the future. With many new challenges facing the nursing practice as well as the entire healthcare system, it's important to consider that improving the education of nurses will help address some of these challenges. Improvement of nursing education could be the first step in the right direction in resolving the many new challenges facing the nursing practice, such as the nursing shortage and the nursing faculty shortage. According to the NACNEP, between the years of 2000 and 2020, the United States population will grow 18%, which results in an additional 50 million people who will require healthcare services. The U.S. is currently faced with a paradox. Even though the supply of nurses is increasing, the nursing shortage is getting worse. These 2 facts, in combination with the current economic status of the United States and its effect on many U.S. citizens, is causing more individuals to consider going to school to become an RN. Potential nurses who are seeking out their education through ADN programs have increased, and there are currently more nurses practicing with an associate's degree in nursing rather than with the BSN, or BS. About 42.2% of registered nurses have received their education in ADN programs, mainly because ADN programs provide an efficient, economical pathway to becoming a registered nurse. Unfortunately, since the nursing shortage is not going to be resolved anytime soon, associate degree programs aren't going anywhere either, as long as it's providing a cheaper and faster way to become an RN. A nursing workforce in which nurses' educational backgrounds are all different and have vast discrepancies, in combination with a shortage of nurses, is not good for the healthcare system and the patients for whom they provide care. A nurse understaffing is ranked by the public and physicians as one of the greatest threats to patient safety in U.S. hospitals. Apparently, for every additional patient added to an RN's average workload, the greater the risk of death after common surgical procedures. The combination of nurses having multiple educational levels with the current shortage of nurses is not good. It increases the likelihood of the patient's safety being threatened, as well as a greater likelihood of negative patient outcomes. Increasing the educational level of the nurses and requiring that all receive the same degree will help minimize putting a patient's safety at risk, especially at a time where they may already be at risk due to the nursing shortage. Nursing prides itself on the fact that it is a lifelong learning profession. Unfortunately, many nurses, especially those who hold lower educational degrees, do not have positive attitudes towards continuing their education or going back to school for higher educational degrees. According to Altman, nurses who had lower educational levels participated less and have poorer attitudes towards education. Many of the nurses who received their ADN initially expressed that they did not need to get their BS and BSN because they felt they could provide good care without it. Unfortunately, undereducated nurses are the ones who often fail to recognize their disadvantage. This is exactly the attitude that is hurting the nursing profession and all that it stands for. Not only that, but this attitude towards achieving higher education levels is contributing to the current nursing faculty shortage. The graph illustrates the percentage of nurses who plan on continuing their education. A large amount of the nurses have no plans for continuing their education at all. According to the American Association of Colleges of Nursing, 52,212 qualified applications were turned away from 566 entry-level baccalaureate nursing programs in 2012 due to the nursing faculty shortage. A major reason for the faculty shortage is because of the small amount of RNs who are educationally prepared for the position. Only 21% of nurses with an ADN return to school to pursue a baccalaureate or higher degree, whereas 22% of nurses whose initial degree was from a baccalaureate program go on to obtain a higher degree in nursing. In order for nurses to be well prepared in the real world, their educators also need to be prepared and qualified to provide a quality education. The nursing faculty shortage is another reason to start encouraging nurses to go back to school to advance their education. Increasing enrollment in BS and BSN programs would also be the first step to addressing the nursing faculty shortage. Requiring a BS and BSN as the minimal qualification to take the NCLEX examination could help improve the overall nursing workforce. It would increase the number of nurses with their BS and BSN, which would contribute to better patient outcomes as well as provide a stepping stone to higher education and advanced practice nursing positions. This would help increase the amount of qualified nurses for nursing faculty positions. With the current and future nursing shortage, it is not a time to put nursing education on the back burner. It's a time to try and improve the nursing practice and workforce in any way possible, and the way to do this is by requiring nurses to be more educationally prepared than they are now. Education in the healthcare system and among healthcare professionals should always be a priority, never a burden. Keeping up with the new advancements in medical knowledge and technology is a part of a healthcare professional's duty, so that they may provide the best care for their patients. So why would anything less be expected of nurses in regards to education? It shouldn't. And this is why nurses should always strive to provide the best care that they can, and maintaining and continuously adding to their knowledge base is the first step towards this goal. Nurses are a huge part of the healthcare system and workforce, and by increasing the amount of education required to practice as a nurse will help reduce discrepancies in knowledge among current and future nurses, as well as help reduce discrepancies in the care provided by nurses, resulting in a higher quality of care and improved patient outcomes.